Is there CPS model is good or working effectively with the kids who might have some difficulties, let's say ADHD, autism, maybe sensitive, highly sensitive children? How does it work in these cases?
Well, those are psychiatric diagnoses, of course.
Mhm.
They are rough summaries that tell us that a kid is exhibiting certain concerning behaviors. So, what the diagnosis is, in my experience, doesn't really tell us whether the model is going to help the kid or not.
Mhm, mhm,
What the concerning behavior is doesn't tell us whether the model is going to work.
mhm,
Um, my experience is the only thing that really changes what the model looks like, not whether it's going to work, but what the model looks like, is whether the kid is able to participate in the problem-solving process through the spoken word. We do this with kids who are non-speaking. It looks a
mhm,
little bit different than it does when we're doing it with kids who are speaking. That changes things a little bit. It doesn't change the process of solving problems collaboratively and proactively. But the diagnosis, number one, doesn't really tell me very much about a kid. Many people are struck by that. And it doesn't give me any information about whether the kid's going to be able to participate in the problem-solving process.
mhm,
So the diagnosis actually doesn't really tell me that much. There are a lot of people who have a lot of pride in their diagnosis, which is great,
mhm,
but I've probably worked, just as for example, with, I don't know, 1,500 kids diagnosed with ADHD. They were all different.
mhm,
I've probably worked with 1,000 kids diagnosed with autism spectrum disorder. They were
mhm,
all different. So I want to make sure that I appreciate the fact that they're different and actually not make any assumptions about them based on their diagnosis. Otherwise, I'm actually not helping them out. If a kid walks
mhm,
in my office and they're diagnosed with ADHD, I don't know what skills they're struggling with yet.
mhm,
I don't know what expectations they're having difficulty meeting.
mhm,
Same for autism, same for oppositional defiant disorder, same for any other diagnosis. So I'm actually a mental health professional who likes to de-emphasize
mhm.
diagnoses because I really don't think they give us the information we most badly need. What skills is this kid struggling with? What expectations is this kid having difficulty meeting?
Okay, that's make a lot of sense. And if let's say someone is struggling, that's ADHD, let's say, as a diagnosis, which doesn't tell us anything per se, but we say there is a mom and she's struggling with, her child is like really impulsive and they cannot. She's struggling with his strong emotions, let's say, in particular situations. So what would be her couple of first steps, or again approach mentally to this particular behavior?
Identify the skills the kid is having difficulty with.
What it could be?
Impulsiveness, thinking of solutions to problems.
Mm-hmm.
There's a good list of skills on the assessment of skills and unsolved problems.
Mm-hmm.
People who are familiar with these skills kids diagnosed with ADHD are stereotypically lacking or struggling with will recognize some of them.
Mm-hmm.
But there's other skills kids with ADHD might be struggling with that aren't prototypically ADHD. So,
Mm-hmm.
once again, I don't want the diagnosis to do my blocking for me. But
Mm-hmm.
then, very critically, they've got to identify the unsolved problems.
Mm-hmm.
Because, except for medicine, maybe, I can't work on impulsiveness. I can work on the problems that the impulsiveness is getting in the kid's way.